Meralgia Paresthetica, or entrapment of the lateral femoral cutaneous nerve. What I'll usually do in my office is do some soft tissue stripping or some trigger point release where I pin a couple of the involved muscles, the TFL and then the iliopsoas, and stretch them out in order to lengthen them out and help reduce some of the pain. I like to start with the hypervolt just to kind of warm the area up. It can be sensitive, and I'll show you where I work here. So we want to find the top of the pelvis and then the hip. The TFL is going to be right in between there. And then if we move a little bit forward, we'll get right over the hip flexor there. It usually can be a little ticklish or sensitive. So after I do that for a couple minutes, then we're going to do some of this pin and stretch technique. So the first one we're going to do is the TFL. So I'm going to take the patient's leg straight here. I'm going to find this TFL muscle, go ahead and contact it with my thumb, and then I'm going to drop this leg down off the table right here. And then reset, pin, extend, and drop right off the table. So we'll go ahead and do this for a couple of minutes, and as this loosens up, then I'm going to go ahead and move into the psoas muscle. So the psoas muscle is a very similar location. Just find the front of the hip here, and then I'm going to go a little bit to the inside. So I'm going to grab the knee. The patient's just going to move with me. So find the psoas, and then I'm going to extend the hip and then bend the knee, just like this. Contact over that psoas, extend the hip, bend the knee, and drop down just a little bit too. So those are a couple things that we can do here in the office. Sometimes there's some joint restriction in the pelvis, in the low back, that contributes to this too, and so we'll do some chiropractic manipulation or adjustments on it. And then with the home exercises, know that about 90% of people are gonna see these symptoms disappear and eventually resolve. If you wanna check out some of our other videos, feel free to subscribe or drop and ask me any questions.